Now coming to the 12th one, which of the following arteries does not supply corresponding regions of dura mater? This question looks little difficult, but let's simplify. Middle meningeal artery to the anterior cranial fossa. It can be because let's see. Middle meningeal artery is middle. It can go to the anterior cranial fossa. It can be. So let's keep that option. Accessory meningeal branch of the maxillary artery supplies middle cranial fossa, and the maxillary artery is also in the middle part only, so middle it can supply to the middle cranial fossa. It can be. Middle meningeal branch of internal carotid artery supplies posterior cranial fossa. Actually, internal carotid artery comes from anterior. This is anterior, this is posterior. Let's think. It comes from the anterior. So it has to supply anterior or middle. It can't go to posterior. Posterior, we have a vertebral arteries and all to supply for a posterior cranial fossa. Though, so this cannot be the option. Let's see the fourth option. Meningeal branch of anterior and posterior ethmoidal artery supplies anterior cranial fossa. Yes, it can be. Anterior cranial fossa, it can supply to the anterior cranial fossa. So, most probable answer is answer C, which is internal carotid artery is not supplying posterior cranial fossa. So, what branches you can see? See, meningeal branch from a occipital artery and the vertebral artery are going in the posterior cranial fossa, whereas these things are the anterior. Here middle meningeal artery is there, then anterior meningeal artery from the ethmoidal artery is there, middle meningeal artery is there. This all comes in the anterior and the middle part, whereas this vertebral artery and occipital artery comes in the posterior part. So option C is the wrong option here. Next, the 13th one. Which of the following is normally seen in lumbar spine? Lumbar, L for L. It is lordosis. Let's see. In the cranial, cervical, sorry. In the cervical also we can see the lordosis, that is this type of curve. Whereas in thorax we can see kyphosis. Whereas lumbar again lordosis. Wait, let me tell again. Cranial, it is in cervical we can see lordosis, whereas in thorax you can see the kyphosis, and again in the lumbar you can see the lordosis. Next, Meissner's corpuscle are present in. They are present in the capillary dermis. Yes, we have an image. Yes, it is a. It is for the touch and 2-point discrimination. This corpuscle helps in, and they are the rapidly adapting corpuscle. Yes. 14th over. Now 15th question. The correct pair of lymph node level in the neck and the anatomical boundaries amongst the following are. They are telling third level is for cricoid to clavicle. Third level. Let's see. This is the hyoid bone. This is the cricoid. And here is the clavicle. Clavicle, the cricoid to clavicle, that is fourth one. But they have not asked that. Now first we have to see from hyoid to cricoid, there is third one. They are telling hyoid to cricoid, but they told they are clavicle. That is wrong. Actually, from hyoid to cricoid is nothing but third one. So cricoid to clavicle is fourth lymph node. fourth lymph node. Cricoid to clavicle is fourth one. Cricoid to clavicle is fourth group of lymph node. Base of skull to cricoid is fifth one. No, base of skull till the clavicle is fifth one. See, base of skull to the clavicle is fifth one. Whereas sixth one is hyoid to clavicle. Yes, actually hyoid bone to till the clavicle, it is the sixth one. So this is correct one. Next, 16th one, ligamentum flavum has a high levels of high levels of elastin fibers. So 80% of it is content is elastin fibers. It helps in stretching without any damage. Next, 17th one, which of the following nerve is not involved in olfaction? This trigeminal nerve, yes, it is involved. Vagus, actually secretory, it is involved, and glossopharyngeal also involved. Whereas hypoglossal is purely a motor nerve, so it is not involved in sensation, that is olfaction here. Which of the following sensation is not perceived by spinal nucleus of trigeminal nerve? Here you have to remember spinal nucleus has three parts. One is mesencephalic and principal sensory and spinal. They are asking about the spinal. Actually, spinal nucleus has a pain, temperature, and some extent to touch also. Whereas mesencephalic is only for proprioception. So spinal will not have proprioception for 100% sure. So here spinal nucleus of the trigeminal will not have a proprioception. So done with 2018 paper. Thank you.